Hello and welcome you all. It's absolutely fantastic to have you here and to have you on time. We are going to get going in just 1 second with a session I've been looking forward to for quite some time, actually, and it turns out it's a pretty popular one. We've got more than 500 of you registered, and it's the second part in our summit series. That's right. I know that you too have been losing sleep over this, but rest assured, we are ready to go. This one is, as you can see, called Push to the Summit, From Insight to Decisions. And I guess the reason for that is because the first of our sessions was very much focused on why and what. And today we're going to go from the what to the how, I guess you could say. So it'll be a little bit more practical. I'm hoping that a fair few of you who are watching right now came to the first session. And indeed, as I said, this is part two of two. There will be further chapters in the Summit series coming, but I'm just going to have to hold back from sharing that information with you just now. But if you do want to see part one, have a look at your screen now. There is a QR code, which in case you missed it or you just want a recap, you can access it via that code. So grab your phone and send yourself over there. But let's have your attention fully focused on today's session. Now, those of you who were here before will be familiar with the chat window. Why don't you find the chat window right now and say a little hello. Say what inspired you to come here today. Say where you're calling in from. Say why or what it is you want to hear from today. Please do, by the way, make sure you get all your questions out there because that's the only way, of course, we can make sure we deliver for you. So I want to see an active chat window today, please. This is me. I'm Paul Sims, speaking to you from London at the moment. And today I'm going to be joined by Stacey, Lance, and Mark. And we are missing Alex from the first webinar. Unfortunately, he had a late change in his schedule and couldn't make it, but he is very much here in spirit. And as you will see in a moment, he is here on a slide too. But just in case you are here for the first time, Stacey, Head of Medical Excellence, US Oncology at AstraZeneca. She is a scientist turned strategist, although still a scientist, as you will hear in a moment. She brings that precision thinking to medical excellence, and she's worked across academia and big pharma, elevating teams and standards, and gave us a really useful perspective last time because, of course, as many of you will know, AstraZeneca, particularly when it comes to oncology, is in a multi-launch situation. In fact, quite how anyone manages, I do not know the number of launches that they have going on at the moment. Lance is the CEO of Within3 and somebody who I hope you have met before on one or two of our past webinars because he's a fan favorite. He's a technologist. He's on a CEO mission to modernize our industry and obviously draws a lot of inspiration from the world of large tech companies and what we can do. And obviously, this interaction between data, insight, and human experience is a rich area of progress that we as an industry can really improve in. And thank God we've got people like Lance here to help us. And Mark, someone who we've really enjoyed having at recent Pharmageddon meetings and is just generally an all-around good guy. He recently moved actually from Novartis to Grifols, so he's experienced from large to mid-sized pharma, but he's always been a leader, a genuine leader on the commercial side of the business, connecting strategy, data, and innovation to drive growth. And someone who I seek counsel from time to time because he is one of the smarter operators in our industry. Thank you so much, guys, for being here. I asked you some questions when you signed up for today's webinar, and let's have a quick look at the results. First one was, if you try to improve launch decision-making this year, where would you actually get some pushback? Okay, if you really tried to shake things up, what would happen? So you can see the highest one there was 29%. Medical and commercial protect different priorities of misalignment. And it's obviously not the first time we've heard that. Probably no huge surprises, but yes, different priorities, same ultimate goal, but as we know, different methods. Decision ownership is still too fuzzy or consensus driven. Consensus sounds like it's the thing that we want when we're launching, but obviously we do need a little bit of artistry and individual nous as well. And that consensus driven can really slow us down and shoot us in the foot. Decisions don't translate cleanly into execution. So there's perhaps a gap between the decision layer and the execution layer in nearly 20% of companies. AI assisted insight is still not trusted enough. That was a significant portion, actually. And then the last place was good enough evidence is still too hard to agree on. Okay, so that was the first question. Second one was how much change to your launch decision model could your organization realistically absorb in the next 12 months? Again, slightly even results for the top three, as you can see. So let's have a look which one won. It was this one. We could pilot a new model on one brand or team. So we take things in bite-sized chunks. One brand or team was nearly a third of the vote. And then very equal here, we could tighten parts of the current model or discuss it, but change would be slow. So incremental. We can improve governance, but not redesign the model at 15%, and it's simply not a realistic priority right now at 5%. Okay, so a few little insights there, and I promise you there will be a couple more live polls going on in a moment. Just a quick recap of what we got to in the last webinar. I'm sure not all of you recall, it was about a month ago now. We have data, okay? I think there's no illusions, no great worry that the data source or the quantity of data is the issue that we have, even the quality. If I compare that to a few years ago, I would say it's been different, but now that is not the bottleneck. And of course, we have insights, but perhaps we have so many. It's like a detective trying to look at the most frightening crime scene board that you've ever seen in your life. And each one of them individually may well be a valid insight, but which ones do we act on? Where does the real decision making come from? And I kind of liken it to, we've almost got, a fast car, but it's stuck in traffic. If our decision making, if the actual road itself can't be cleared so that we can get the maximum performance out of this. Now, a few little quotes and stats. 50.8% of you in the last webinar said that when a new signal challenges the plan, it takes at least several weeks to adjust. And that's even when a clear decision has been made as a result of that signal. We are not responsive as organizations in general. But speed to action is not the key measure of success. It's not just about speed, and Alex made that point in the last webinar. It's not just about rapid reaction forces. You never have enough time. Mark really underlined that. No matter how fast you go, it's just never enough, frankly. And what we really did see is that it's a matter of being a little bit nuanced. And as Stacey said, we may need a more explicit way to grade evidence quality rather than treating all inputs as equal. So we absolutely need to know what to act upon because it's not everything. And then Lance, AI doesn't replace judgment, but it should radically compress the time it takes to understand what matters. So it's not just being rapid reaction to implementation, it's rapid reaction to decision and making sure that the decisions actually stack up with the use of sufficiently grounded technology. And I think that's the nuance that we managed to get to in the previous conversation. I did really enjoy what Stacey said towards the end. A launch leader should be creative, but a scientist at heart. I would argue that we describe ourselves, of course, as scientific companies a lot of the time. But are we really scientific outside of drug discovery? Are we really ensuring that we're not basing things on assumption? Are we as curious and as experimental and as hypothesis-driven as a typical scientist? I would argue that we have some way to go. And that doesn't mean that you're not creative, as I said earlier, but you are willing to explore and willing not to rely on assumption and willing to make changes. Scientists are willing to make changes according to what the facts reveal. Of course, she added and fun as well in the final part, which I thought was important enough to retain here. Okay, so I'm going to ask the panel to turn on their cameras, but I'm actually going to ask Lance in particular to just show us a little bit. So if you remember from the previous discussion. It was all sort of entirely debate and discussion. And now there's a call to actually see something concrete. So, Lance, I think you've got a couple of slides that can really help distill a lot of what we've just been talking about. So please do go for it.
I will. So hopefully, let's see. Can everyone see that okay?
Yes, all good.
Perfect. All right. So these are just some, thanks, Paul, for asking me to put together a few things. I just put together a few slides and maybe help frame the conversation for today. And so I kind of channeled what Alex and Mark said on this graph on the left side, the y-axis, which is like speed and productivity, and on the x-axis a little more where Stacy was coming from, which is kind of quality of evidence and quality of insight. I think what we're all trying to do is get into the upper right corner, and when you look at this grid, really our ability to do both of these things at once with AI assisted tools is really what's changed. And that change is happening at a very, very, very rapid clip. The ability of these tools to drive speed and productivity and quality in kind of leaps and bounds is growing every 6 months. And so it is something that I think is if it's not part of what we're doing, we're going to talk today about how can we make it part of what we're doing and thinking about some of these tools. A lot of the ways that we would do kind of deeper insight quality with primary and primary research sorts of methods and things like that in the lower right are very time consuming and slow. And a lot of the, kind of Copilot, Claude sorts of productivity gains from AI tools generally in the upper left are speeding a lot of what we can do, but they're not necessarily built and targeted with the rigor to help us understand launch dynamics in a deep way. And that's really what the opportunity is in the upper right and where these tools are going. So what are these sort of AI tools at a very high level? How are they being built? Um, so they start off with data. So Paul, you had the kind of the pilot screen. Um, the more data you can have in your system, the clearer view you have, the more signals you can detect, the more things you can cross-check and cross-reference. A lot of these different data sources at the bottom have different time frames. So some might be great for doing kind of longitudinal analysis. Some might be great for what's happening real time. But the idea of pulling all of these data sets together to power the systems that we're using is super important. A lot of these data sets are not available on the general internet and therefore not available to the chat GPTs of the world to do that sort of work. The next layer that these tools do is they try to model the market. So, as an example, if I'm in a therapeutic area where community physicians are very important to, how care pathways work, um, I have a very different mindset of weighting what I'm learning from community physicians versus maybe academic centers or vice versa. Or if I'm in a rare disease area and patient voice is incredibly important to care decisions and things like that, I might weigh that differently, and that might change by region. And so these tools, the better job that they can do at influence mapping, understanding what the weighting is between different types of data and sets of data, allow them to create a much more accurate sort of market view. This is the part today where a lot of the tools are falling short. So there's a lot of tools that are just summarizing individual data sets down here at the bottom using AI, but what they're not doing is understanding that market model as a whole. And the last thing for these tools is they should be being able to be used by everybody. So these aren't tools that are just for analysts or just for marketers or just for executives. These tools create a single view of the truth, that single market model of information, and then you can power all of these different roles to further collaboration, decision making, so on and so forth. Um, so I'm going to dive into these quickly, and then we can kind of react as a panel. So in terms of the different sort of roles, I've bucketed them in this way for this discussion. But speed and productivity can impact all of these different roles. So if you're in the field side, the time it used to take, days and weeks to, research HCPs, understand preferences, prepare for congresses, to if you're on the field team leader side, it took, days and days and days to kind of do reporting on field insights and things like that. All of those things are done in minutes now or in an afternoon with these sorts of tools. Similarly, if you're a medical strategist or you're an executive and you're preparing presentations, trying to organize all the information and communicate it and share it, that being done all manually, whether by you or through agencies or what have you, takes it's just not fun work, to use Stacy's quote. It's not the fun part. That can all be done in an afternoon using these sorts of tools. And so the speed is a productivity gain, yes, but it's also you spend less time doing the stuff that's not fun, and more time being a reviewer and an assessor of this work than kind of the grunt work part of it. And that allows all of us to move faster. That only works if you kind of have those stacks and layers. In terms of just the kind of the where the different kind of sets of these tools are, and it also depends on whether you're in a small or mid-sized company like more Remark is, or you're in a large company like Stacy's, what you might be doing across these. But we're seeing small and mid-sized companies really just use, they're downloading things into Excel, they're using Copilot, they're trying to use some of these tools to get some of these gains and assist them with some of this analysis. A lot of the large tools or large companies are trying to build things internally, kind of enterprise-wide solutions around insights and intelligence and workflows around it. And then, what we're building on the right and others like us are really this kind of integrated intelligence engines that are able to do very complex market modeling and then apply that in to get much deeper sorts of information and insights across different sources in real time. And so any of these three will certainly kind of up and to the right on both cases as you go from left to right, drive speed, productivity, as well as insight quality and speed to decision making. And then the last thing I just wanted to share is the ability to then, so much of the burden is we have all this data. How can we make better decisions? And so much time is spent and wasted trying to interpret, organize, and communicate the information. These tools can really, even if you just look at that layer of the stack, these tools can do really amazing things to help understand differences that we're seeing across data sets from different places, what the ultimate conclusions are, and what we should do next, and trace it all the way back down to underlying data. And so, for me personally, some of the work that we used to do more manually from a consulting standpoint, I couldn't imagine doing that without these tools at this point. It just seems like it could be such a waste of time. The information is so much stronger as these tools get smarter and smarter. So that's kind of sort of what's possible as we go to the upper right. Every company's on its own journey of starting, maybe doing the consumer route, maybe building things internally, maybe partnering with vendors, some combination thereof, maybe doing it at the enterprise level, maybe doing it for specific TAs or specific launches, maybe doing that kind of led through the more like the business marketing and strategy or medical director teams versus maybe led through like an excellence or an ops group. There's all different ways that companies are trying to get there. And I think that's the purpose of today, is to talk about some of those things. Hopefully that was helpful as a context.
Yes, indeed. Thank you so much, Lance. That was super helpful. So, Stacey and Mark, yes, you're there. Marvelous. Obviously, want you to come in on the conversation now as well. You will appear on the stage in just one second. What's your reaction to what Lance said? Does it sound like it's the right way forward? And in particular, how do you think that specific roles might change? That's what I mean. Lance obviously said you can't go back. And certainly he wouldn't go back, having now obviously got his hands on this. Really curious as to where you are on this.
Mark, please, I'll defer to you first.
You've been
Thank you,
volunteered, Mark.
Stacey. Voluntold. Lance brought up a really great point. Yeah, it stuck with me about singular insights or intelligence to integrated and fully connecting information. I think the expectations of different members of teams, whether it's executive leadership or a salesperson or a brand manager or even an analyst, now have a different expectation because of their experience in life beyond their day job, where information is aggregated, connected, and collected as a single source. And so that really resonated with me, and how we look at data, how we look at research, and how we start integrating that makes all the difference on preparing for a launch and actually measuring the progress post-launch. So I thought that was a great point that Lance brought up in the discussion.
And just sticking with you, Mark, for a second longer, which role do you think will be transformed the most in your experience of harnessing these technologies and your prediction for the near future as well?
I think all of them will transform a lot, to be fully transparent with you, Paul. But I think the biggest role that's transforming is the analyst role. You know, it really starts with stitching the information, stitching the stories together. Leadership questions still are the same. They want to go faster. They want to understand the maximum penetration they have on market. They want to understand competitive dynamics. Those questions fundamentally stay the same, but how we get to the answers has evolved quite a lot already, and I expect it to evolve even more as we go down path.
Do you not think, Mark, that in the short term, of course, the analyst role, and that's where huge efficiencies and time gains will be made, but with the expectation of more real-time information and the possibility of faster and more accurate decision making, that the leadership role will perhaps change more in the medium term? Do you see that, or do you think that I'm getting slightly ahead of myself and I'm getting as excited as the average Silicon Valley tech pro at this point?
Well, I definitely see that role evolving quite a lot, but I see the role of a brand or a commercial leader even evolving more. The expectation to communicate the integration of medical value and access, sales, marketing, competitive dynamics, all roll into that brand or commercial leader that reports into the executive team. Those roles are becoming much more complicated, and the pressure to understand all those little parts across the journey usually bubble up to one or two individuals within an organization or a brand team. I see that role becoming much more dynamic and much more of a quarterback role across all the tools to get the patients the medicine they need.
So, Stacey, as somebody who is handling multiple launches on multiple different dimensions, and you as an individual are involved in more than one, I don't know if that's the case for everybody, but where do you need the greatest impact to be made, and where do you see the greatest impact being made in terms of roles in the current and near
Good
future?
question. Yeah, where do we need? Well, I guess, of course, I'll reveal my bias of what role. I think medical for sure. And when I saw, Lance, your 4 roles that you saw impacted, the first thing that came to my mind was the medical director, because I think for them, as you move into that upper right-hand quadrant, high quality insights that are being synthesized really quickly, their role is being transformed. They have an identity of being the scientific and medical experts. But now, what do you do in a world where AI can serve you up an answer? If your brand team needs that quick scientific response, they're going to go to the AI. So having a medical director that's more versed in the decision scientists or decision science, I would say, or behavioral science, that's the part where I think their role is going to be transformative. But that's a whole mindset shift. How do I still be a scientific expert? Because, oh, by the way, you can't just offload that to AI, but people aren't going to be coming to me for that. They're going to be looking for those human inputs. So I think if you're asking me, what do we need? I do think more investment in decision science and people thinking about how do I actually make decisions? Because if you're doing it based on gut or intuition, we know that that's bias and heuristic. So how do we get better at that? And just a new operating model, being in medical excellence, that's definitely a hot topic for me.
Okay, I'm going to flick this one to the audience before we come back. So have a look at your screen now, and you'll see that poll hopefully appear, and we will get the wisdom of the crowd involved in answering this question as well. Which role in your organization would benefit from fast decision-ready intelligence? So we've got a range there. And then, of course, which part of the process is least developed in your organization today? So if you wouldn't mind taking a look at those. And I guess, Stacey and Mark, I guess I'm really interested to understand whether you think that as we adopt these tools, thinking about it in this role-based way is actually a smart way for change management to occur. Again, Lance, and probably like myself, we tend to be a little bit technology first. No problem with that, hopefully. But we tend to think of things in a quite objective way. And look, we can just make things more efficient. Look, we can just make things quicker, smarter, blah, blah. And it's a logic-based argument. We all know that humans are not fully logic-based. They are psychologically based. And I just wonder whether or not this role-based approach and looking at individual, how they change, how they individually shape their role is the smartest way to perform a rollout in the short term, in your opinion.
I'll jump in here first, just because I feel a strong yes.
Okay.
Mostly because I'm coming at it from a change management perspective, and actually just chatting with some of my communications colleagues recently, they were talking about if you do change management well, you avoid moving into crisis management. So the idea of telling people why you're making the change, I think they've probably been inundated with, why you need to start thinking differently with AI. But the second step from a comms perspective in change management was telling people what role they have to play in the change and what they stand to benefit. And so in my opinion, the only way you can do that is to come to people with their role specifically. I understand what role you do. Here's how it's going to change. Here's the opportunity, and here's how you can be part of it. So I'd be curious if Mark or Lance, you have an opposing viewpoint, because I feel pretty strongly it has to be a role-based approach.
Yeah, Stacey, thanks for getting us started on this one. I look at it from two fronts. One, technology is part of everyday life here. And we need to make sure each role has the technology and the tools to optimize their job. And that's evolving hourly with the new models that are coming out, new software that's coming out. And we as an organization need to get away from the mindset of enterprise solutions versus role-based solutions. We need to start looking at role-based solutions, bespoke tools for the role. Does everybody in the organization need Claude, or does the analyst need Claude? And we need to have those trade-offs depending on what the roles are. But also, when you look at true enterprise, you really want to focus on the jobs to be done or the problems to solve versus the individual. That's how we have silos. And technology is really great for breaking down silos. And we want to embrace what technology can do in order to optimize the full value of an organization versus optimize a role. And there's a balance between the two. Us as people, we have biases and we want to protect our roles, our territory, our silos, or our kingdoms within corporations. Technology's job is to break that loose and really stitch everything together to drive the most effective and efficient organization possible. So I see it on both sides, Stacey.
Mark, the phrase that comes to mind as you're talking is we tend to overestimate what can be done in the next few months and underestimate what can we do in the next decade. And so I kind of feel like talking about role is perhaps a way of making it understandable and less scary, frankly, to people in the short term. But at the same time, if by the midterm you haven't managed to rethink on a more fundamental level what the very nature of the role and what the makeup of the organization should be, you're probably failing there as well. Would you agree with that?
I would. I think there's a fine line between optimizing performance for today while transforming for the future. And I think as leaders, everybody has to have that lens on as technology becomes such part of our life.
Yeah. So Lance, you've obviously been rolling out technology tools for quite some time, and I had a really interesting chat with your team about how by focusing on role more recently, it's actually gained a lot of traction. And as a technologist, I wonder whether or not that I don't know, does it frustrate you a little bit that it's not necessarily always just the logical equation, but it has to be the human equation, or is that completely what you would expect and indeed the rollout that you're most content with?
I think that's what I would expect in that. I mean, I agree with everything Stacy and Mark said. I'm trying to find something I could disagree with to add some spice in the conversation.
Try,
Really,
try.
I can't find anything yet, but hopefully, maybe I'll say something dumb that they can disagree with. I feel like we're on the tech side where people make mistakes is we're going to build a big solution, roll it out to everyone, quote unquote, but it's kind of sort of built for no one. And if I try something new and it's not immediately obvious how it helps me, now I'm being forced to do something that I kind of sort of would rather not be doing or not comfortable with or is not how I've done things in the past. And that's where I think a lot of technology rollouts can break down is this idea that we're focusing on scale across the organization versus getting people, giving people tools that let them do their jobs better. So I think that if you're not deeply involved with how individual roles and the titles are different, the domains are different, but the functions are kind of the same, right? I've grouped them into those four high level buckets. There's obviously a lot more detail underneath those, but the functions are kind of sort of the same. And they're repeatable sorts of critical thinking, analyst collaboration, communication sorts of functions that are happening that we're trying to all support and enable. What bothers me the most is when I see companies, oh, we tried to, you mentioned Claude, we rolled out Claude and people didn't like it or whatever. And it's just like, it's the tech's fault. And it's like, well, did you roll out something for an analyst, to Mark's point, that made their jobs tremendously better? Did you roll out Claude? If you did the former, you would probably have had a very different experience. Picking on Claude. Obviously, Claude can't do some of the things that we're talking about here on its own today, but yeah. So I very much agree with that. I think that's where technologists fall down a lot is they don't design the technology with roles in mind. They design it for scale and widespread enterprise rollout. The same thing with role, I think, by the way, also applies, as I mentioned earlier, to the assets themselves and the regions in which they're operating and the health systems within those regions to understand how what data matters and why and to what degree as you're looking at these massive amounts of data. If something is very, very account driven in the US in terms of market access versus no, this is something that is very bottoms up driven in terms of how patients find their way to treatment, what you're looking at in the data and what you're weighing when a KOL online says something in scenario A versus scenario B is probably very different. And so I think where you also run into issues is the tools don't understand that it is not a one size fits all data summarization project. It is a market modeling project per asset and then potentially per region per asset, depend if all those dynamics are different, to actually end up with insight quality, back to Stacy's original point, that is useful and at par with what you had done if you had done a 4-week study or a 6-week study or whatever, but you're getting it now in minutes.
And
Thank you, Lana. Oh, go
I
on,
was going to
please.
say, and I do like, Mark, your point about starting with the jobs to be done, because you're right. You don't want to get so tunnel vision on your role that you forget ultimately what are we all trying to achieve. So I think that's a fair point. But maybe, Lance, to what you were saying, if the technologist gets the job to be done, then the execution, though, or tactically, or however you want to say it, does have to be role based. That's fair.
Yeah, absolutely. Thank you, guys. I'm going to share the results of the poll to see what everybody says, but I also want to shift us onto a good question I saw from Harris in the Q&A, if you haven't seen. And I thought, Lance, you were about to answer this because you started to, but I think it's actually still worth visiting. Analog doesn't equal prologue, and AI depends heavily on absorbing the history. How does that impact first-in-class launches or a launch where you have new drivers? And of course, AI, we all know, is reliant on precedent to a certain degree. And effectively, a model has to guess by analogy. Weak analogies then give false confidence. So, Lance, I guess I would love to just hear your technologist's answer to this question and indeed how confident you think we can be when we are trying for true originality in our launches.
I think it depends on what you're trying to answer. So if what I'm trying to answer is, I'm working for Mark and trying to build a forecast model for a particular asset, that's a very different question than, I'm working in Stacy's organization and maybe trying to understand, current clinical behavior and why. So I think you start off with what, and then whatever those questions are, those kind of core questions that you're trying to understand, all of those data sets that I showed in the slide, some of them are really leading sets of data that you can be long before you get even remotely towards launch. There is data being gathered from some of those different sources on what the current state of care is and what's behind the current state of care that you can use to kind of project what may change as your asset progresses towards launch and then into launch. Many times assets you can look at corollary assets. So let's say this is something that's truly novel and truly new coming into a new area. You can inform behavior by analogous sorts of assets in the past, maybe within a TA or an adjacent TAs can sometimes be interesting as well in the analysis. But I think every one of these sets of data lends itself to either leading indicator all the way towards like, looking backwards, like how did the asset perform in the marketplace, and understanding that you can do some really, really super interesting things. And I think back to the productivity side of it, because you can now in these tools work with these data sets so easily and so quickly, you can head down a path and realize there's no there there. And 20 minutes later, go down a different path and realize, oh, there is a there. We should dig deeper into this, or we should go gather more data on that. That is much easier to do now than it was when every time I place a bet that I'm going to head down a path, I'm waiting, 12 weeks for an ATU study to come back or something before I can figure out if I'm on the right track or not.
Okay, guys, you can see the poll results as well that appeared. It appears that Mark's the winner, with commercial leaders being the strongest audience. And sorry, Stacey, medical down at 6% there. I guess you're going to have to make that case even more strongly internally. But there we go. I've never seen an answer with such even results as the second part of the question here. Clearly, everything's least developed is perhaps my translation of that. So all good there. I want to move us on to another part of the conversation. As I said at the beginning, today isn't just about what and why, but very much about how. And we've just talked about roles, but I also want to talk about why adoption still kind of stalls on a general level. What, if I ask you with a blank slate, would you say are the biggest blockers? Like, everything we've said seems logical. We're all nodding our heads. I'm pretty sure the audience is with us too. Yet somehow there are still things going on. For example, there's the equation about whether we should build ourselves or buy in. There's a lot of conversation which goes on about where to start, enterprise rollout or pilot, certain geography, whatever it is. I would love to get all of your opinions on what you think the greatest blockers still are that we really should be able to remove at this point, and also what your preference is for focused rollouts. If you have to pinpoint it somewhere, where would you go first? So let's start with Stacey and Mark. Yeah, sorry, go on, Stacey.
Well, Paul, I was just going to add, so clarifying blockers or barriers to adoption in terms of these new LLMs and how we can revolutionize launch, or are you thinking?
Well, full launch platforms, the sort that Lance was describing a second ago, and which this company. So LLMs and adopting Claude, I would put that in a slightly separate category, if that's okay. We're talking specifically about the technology that is going to bring us really robust and successful launches. What are the blockers to actually enabling those to hit our organizations, and what is the ideal rollout?
So I've got three things. I'll jump in three categories of things. I'd love Stacy's and Mark's perspective on them. For small and mid-sized companies, a lot of times we're unaware of what's possible. We don't feel like we have a lot of funds or money to do the things that the bigger companies are doing. So I think it's almost like an awareness and maybe a misunderstanding of the cost profile of some of these tools is what we see commonly for small and mid-size. For large companies, what we see a lot is someone centrally is figuring it out, so I shouldn't experiment or learn until that comes to me, can slow down. So the tension between kind of what personal productivity or personal experimentation you're allowing versus kind of being, on the receiving end of broader enterprise rollouts. Both have their place, but I think that is interesting for those sorts of companies. And I think the third one that we see, and this kind of goes between both small and large companies, is folks who are just skeptical. Like I've read too many articles of, where these things went wrong, and I'm just highly skeptical of the whole concept. Those are the kind of the three buckets of things that I've seen multiple companies, but I'd welcome Stacy and Mark's point of view.
Just quickly, Lance, on the last of those, is that just a sort of laggard perception and a sort of any change is change that I'm going to resist and sort of heel digging, or is it kind of, do you think there's any legitimacy to that?
I think it's more an emotional response, and then more of just a lack of, if you're not in these sorts of environments, you don't really realize what's possible, and how fast they're getting better and changing. So I think all of those things play into it. But I think, a lot of people, especially sometimes in leadership, got there because they're pretty confident that what they did their careers worked. Hence, I am now in leadership. And here comes something that is challenging a lot of how I did what I've done. It can create the opposite dynamic, that oftentimes we're looking for, until something really pragmatic and obvious shows up on their plate, and they go, "Oh, this is much better, faster, cheaper, whatever, than what I was doing before." So sometimes getting to that level where you get that emotional shift is just, it's a human thing. But I see that a lot, and I'm quite sure people like Stacy have become experts in, you know at triaging kind of the emotional state of the folks that she's working with, and figuring out great change management ways to make that happen.
That is true, Lance. But it goes back to the very first question, Paul, that you showed on the screen, which was, if you had a better decision-making process, where would you get the pushback? And it was interesting, before I saw the results, my first thought was, I actually don't think I'd get pushback. The desire to want to get better, cheaper, faster is there, but I think all the human elements that we were just talking, and when you're talking about something like launch, it is so multifactorial that, actually, having read several change management books of late, there was this kind of very visual description that this change manager professor had, which was, imagine you have an office, and you have your desk and your chair and your couch and whatever it is, but imagine there's a string tied to everything. So the chair is tied to your desk, which is tied to the lamp, which is tied to the couch. And so the idea was, you think that, oh, I can better, move my chair up. But as soon as you move your chair up, the string pulls the lamp, which pulls the drawer, which pulls the couch. And so all of these levers now start moving that you didn't even intend to. You liked your light where it was. You didn't want to move that. And so I think launch feels like that. There's so many parts that, if, yes, you want the desire to change one, but maybe you're scared, or maybe you don't even know, if I change this, what is the butterfly effect?
And the answer is, we haven't read
Mark,
the book.
over to you.
Yeah. What is the butterfly effect, Mr. Mark?
Thanks, Stacy.
That
Appreciate
was
it.
the opening chapter of the book. You've left us on a total cliffhanger there, Stacey. Jeez.
I go back to what Lance was saying. The historical success factors is what got people into the roles that they're in now, along with the organizational muscle. So there's a mental muscle there that every organization operates off of the standard quo. And what we're asking quite often is, how do you disrupt that muscle? The thing that got you here, the thing that made you successful. And that's when you look at silos. Silos are a real thing that pop up in every medium-sized company, small company, and large company. Silos are a real thing. And they're often misaligned by goals and incentives. And that's a real breakdown. And then finally, you're in launch mode, Paul. So when you're in launch mode, the focus is about solving today, and the pressure is on with everyone. So the appetite to pause and rethink things isn't always there with that pressure and the misaligned goals and the silos and the historical muscle we all bring. I think what we need to do, particularly in the world of insights and execution, the area that I focus on, it's really about how do you bring behavior change into an organization? How do you bring people into the process sooner? How do you purposely break down silos and integrate conversations that normally don't happen and use tools and systems to do that? And then everybody agrees on a way of going forward, incrementally improving every launch, every commercial exercise that you can get to, making sure that everybody on the launch team feels that they're part of the journey and no one's standing off to the side.
Mark, thank you, and thank you also, Stacey, for the lovely story. And both of them make complete sense. I haven't got an argument against anything that you guys have said, but I also want you to answer the second part of my question, which is, should you try and create a level of focus? Now, Mark, I realize that within your answer, you was basically saying you're in launch mode. You know, there's not time to sort of think of a staged rollout a lot of the time any more than has been dictated from on high. So that might seem impossible, but in an ideal world, what would you tackle first? And that question is to all of you, by the way.
Yeah. From my lens, Paul, I think what I would have tackled first and will continue to tackle first is break down roles and focus on the jobs to be done along the patient journey. And
Okay,
we're really
so
focusing on that patient and what needs to be done. And then where can we as a group decide to apply technology to unlock more value?
okay. You can see, by the way, the results of the audience poll there. So have a look at that if you like. Stacey?
Yeah, Mark, yours is interesting. I think for me, I was just thinking of one of the advantages that we've seen with AI, where people are not skeptical, as Lance said, because once you start getting into data and where is it going to impact performance, then they become very good critical thinkers. But where they get the quick hit of something productive is in brainstorming and actually coming up with novel ideas. And AI being particularly good at, if you give it the right data sets, at making the connections between them. And so this idea of having people leverage the tool for what it is. And, recently heard the description of, if you imagine you have the world's best expert in, let's say personal finance, and they were sitting next to you on the plane, or your favorite, actor, whatever it is, imagine that you could ask them any question. You probably could think of, oh my God, I have this, I don't even know who personal finance would be, but I have this wonderful person. I would want to ask them all these things so I could maximize my portfolio. AI is that person. And so if you are just asking it your basic Google searches, you're leaving a lot on the table. And I think I brought this up last time. And so if we challenged our teams to just say, what's your biggest issue in launches? And leverage AI to actually help with the brainstorming, not the data, not yet. Again, change management, get people comfortable and trusting the tool. Come up with something that, yes, if we could fix this one thing, I would be happy. And at least start there. That's what I'm thinking.
Right, solution oriented.
Something I would throw under that, Paul, as well, is never waste a good deadline. So the advantage of a launch is like you can consensus you about whatever you want, but the fact that we're launching on date X, like that's not a matter of consensus, that's a fact. And so we have things we need to do, or the fact that we're all going to ASCO and ASCO is on this date and we can't consensus our way into having ASCO be a week later because we're still working on something. So I feel like a lot of times the frustration of those who are trying to bring change into an organization is this perception like it's too slow, it's too hard, I'm having trouble getting people aligned. I think launches in particular can be great microcosms to try to push some of those innovations forward. They typically have obviously a big spotlight on them. And so they're also really good to then kind of socialize out to other groups. So I'll just come back to never waste a good deadline if you're trying to enact change.
As a deadline motivated person, I really like that, Lance.
Yes. I love deadlines. I love the sound as they whoosh past. One of my favorite quotes. Sticking with you for one more second, Lance, your colleague Ali has kind of answered this in the chat window already, but I am still keen to just surface this one because I ran a workshop all day yesterday at a large pharma company, and this exact problem was one of the key things that we couldn't really get past. There is exponential advancement. This is from Tracy McCarthy. There's exponential advancement and change in AI on a weekly basis. The tools are just gaining skills and speed. If you obviously pay any attention to the tech news, you are inundated with more launches than you can possibly even comprehend, let alone actually follow. So does that actually hinder being willing to get your hands on it? Is there any point in learning something that might end up being redundant? And of course, I understand your platform is a little bit more stable than the average consumer LLM rollout, but I'm just very curious as to whether you actually see that problem and if it's ever legitimate, and whether you have any answer to how to solve it.
I'll answer that a couple of ways. So, so we there's look at the big LLM providers, and even within those providers, there's multiple different models that are good at some things, less good at some things, quicker at some things, slower at some things. And so in our company, we spend a lot of time aligning. We look at them as like big engines that we're managing how much fuel goes in, how much fuel comes out. We're managing where it's like there's a whole set of things we're doing around these big engines to make in our case the insights that pop out be highly useful and valuable, and the other work that goes with it. And so if you're trying to do something like we're doing, which is like build a system that is, best in class in industry, then yes, you need to be consistently always on top of every single change. You need to be testing that across every use case, every role-based function to understand, is this help? Does this not help? Is it more accurate? Is it less accurate? How does that work with the data sets that we have? Can it handle the amount of data that we're talking? Can it not? Token limits remain an issue. So like in our world, that's a big thing. I think though, if you're on the other side of it and you're not trying to create a best in class system around this, and you're just trying to really experience this, I think you're better off just leaning in and trying. I honestly don't think what an LLM does at its core, whether it's a model from a year ago or a model today or a model 6 months from now, isn't all that different in terms of the stuff it does. You're still kind of sort of interacting with it the same way. It's still kind of sort of giving you answers or creating content for you kind of sort of in the same way. The difference is that being quality as the models get better and better. And so I think it's more one of those, as the new innovation comes out, what you're doing, you'll kind of still be doing, you'll just be doing it better. It'll be doing it better, faster, easier. It's not something where you should be like, oh, it's not like learning, like, here's a whole new software package and then here's a whole new other software package that we have to learn. It's not that level of difficulty. It's more, oh, I went from regular gasoline to premium and now my car is going a bit faster. Isn't that wonderful? But I still am familiar with the concept of gasoline. I come up with an analogy. I don't know if that worked or not, but I did my best.
But Lance, I'm gonna yes and, because I do agree with you. And the incentive to change is pretty high, because one of the topics of some of my medical excellence colleagues and I were just discussing, if you're talking about the premium gasoline and you have these new AI tools that are allowing you to do things faster and quicker, you have to be able to answer the question, what are you going to do with that extra time? Because if your answer is, I'm just going to have a nice cup of coffee, that's where, no, the business isn't going to sustain, going to support that. So if you don't have a good answer for, if this part of my job starts becoming smaller, what becomes bigger, then you're going to be left quite quickly. So being able to answer that question, I think, is something that, even certainly something my team struggles with for some of these roles of, yeah, we need to be thinking about this, and myself included. I need to be able to answer that. And so the incentive for me is high. I want to stay on top of this and get used to it and use it, because I want to be able to fill in the blank when the time comes.
Yeah, Stacey, I find that is, we spend so much time brainstorming and working out what the AI will do for us, and we spend very little time thinking about what we're going to do, having had those things covered. And we always say it'll give us more time to think and do, but I think we, from the outset, should be very specific there as to what exactly we should and could focus on. And I don't know if any of you guys have formally instituted any thinking on that, and to make sure that people are considering that as readily as they are considering what the technology does. But I think that that would really help us all define personal goals, I guess, as to what we actually want to do with our lives once we've harnessed this technology, and what actually is meaningful for us, and perhaps speaks a little bit to kind of our purpose and our reasons for being in the industry in the first place. And just wondering, we've only got a few minutes left. Perhaps that's actually not a terrible place to focus and get a final sort of answer from each of you. I do want to make sure that everybody's looking at the final poll. Action readiness today is about action readiness, everyone. I am not satisfied with today's webinar unless I see action actually happening as a result of it. So do please answer that poll. And I hope that very few of you are resting on your laurels as a result of today's and the previous session. Hopefully you feel a little energized and clearer as to where to go. But yes, as I say, what do you guys think? And this is perhaps a little bit of an incentive, if we need one, for this final bit of the conversation. What is the thing that you think that the human should and could focus on? I realize it's probably going to be a little bit different for everybody, but what, perhaps even speak from a personal point of view, what do you want to achieve as a result of having a, solid implementation of the technology live that you perhaps can't do today as readily as you might want to?
I'll start because I know I went last in the first one, so I'll take it on.
Love it.
So for me, a big thing we've been talking about is decision science, how humans make decisions, and I hope all of us here would agree that that's something we want to keep with the humans as opposed to AI. So the idea being that if we have the upper right-hand quadrant of what Lance showed, high quality LLM synthesizing, I want to be able to make better decisions. And so I know your audience is going to say, yes, me too. How? So one of the books that I found really helpful was the Heath brothers, Dan and Chip Heath. They wrote this book called Decisive, I think is the title. And they give tons of great frameworks of how you can make better decisions. But one of them, for example, is just including more options. As humans, we tend to rely on our biases, of course, or we go with our gut reaction or whatever the first emotion is. And so just by even adding one or two additional what ifs, or I think they call it the vanishing options test. If you think you have we either go this way or this way, imagine you can't go either of those. You don't have either of those options. What would you do? And so that's where I think AI could allow us that ability. So give us more options. Imagine this wasn't the case. And even if you end up going with the same thing that you already imagined that you would, they have data to show you make better decisions. And I would argue that most of our people today would say, I just don't have enough time to do all that stuff. And that sounds like a great framework, Stacey, but who has the time? Now you do. And so that's what I would say you could do with your extra time. You can actually follow the data that we have on decision science and leverage LLMs to give you the pieces that would have taken too much prior.
Stacey, you're very good at these closing statements, I have to say. I'm going to pull you in at the end of every event I run from now on. Also, very good at helping me justify why I ask so many poll questions during these webinars as well. Just giving you more options, guys, more options. So thank you very much for that. Lance and Mark, you've got a tough act to follow, I'm afraid.
Yeah, so I'll jump in here. So there's two areas that when I look at technology in my personal life as well as in my team and the organization that I really focus on is when we implement new technology, how do we get people to be more curious? We're giving some time back. So how do you ask better questions? How do you become more curious about what's going on? How do you take a spark and go deeper with it? Because we got time. Now let's go deeper and answer the real meaningful questions. The second part kind of builds off of what Stacey was saying. It's really then how do we go ahead and implement behavior change and really understand how to inspire behavior change in the market, in our customers, in our patients, in our organization. So that spark of curiosity, but then pulling it through to action in behavior change. And that's something I find very important as we look at that new technology. How do we do those two things really well?
Excellent. Thank you. I would argue that a good scientist, to go back to what we said at the end of the last session, is somebody who is naturally curious and experimental. So I really appreciate that, Mark. Lance, you have the final word.
Yeah, I would just say a couple of things. So, in avoiding the whole like, is AI going to wipe out all white collar jobs as we know it in 15 years? Ignoring all of that for a second, at least in today's world, in April of 26, I don't know a lot of people that I interact with who say, you know what, I didn't really have a lot of work to do anyway. So now AI has made some of it easier, and I'm just gonna like work 3 days a week, and it's all good. Like everyone I meet today, so like I'm already so buried. Anything that gets me less buried means I can do something else. And I think that's the reality of where we are in kind of April of 2026 in most, if not all companies. People, companies are managed well enough to at least have some sort of idea of resourcing in most cases. And then the second thing I will say is usually given a choice where you can start to do the stuff that you find fun or you find interesting, and you can spend more time there and not feel guilty that you can't do that because you've got a bunch of this other stuff that is less fun that you can have the tools augment. I think makes everyone's day jobs better. So I think there's a way to look at these things as enabling versus being terrified, or terrified maybe too strong a word, but you read some of these articles, you should be terrified, right? That, oh my gosh,
Yep, got it.
AstraZeneca is going to have one employee, Stacy, when it's all done, it's going to be some big bot in the sky running AstraZeneca with all agents. I think we're far away from that.
Well, that's okay because it will be Stacy. So Stacy,
Right, she'll be the last one. She'll have their fingers on the agent button, pressing all the agent buttons.
Well, thank you so much, Lance, for those prescient words. What do you know? Both of our webinars ended up with fun as a conclusion. Who expected that? Not me. Well, I think that's a fantastic note to end on. Thank you so much, guys. Don't want to make you late for the next thing, but do please, the only point of us doing these sessions, these webinars, is to try and produce a bit of an inflection point in our industry to actually create some change. So Stacy, Lance, and Mark have been incredibly generous. Alex as well in the last webinar, giving up their time and energy with simply that as its purpose, trying to make our industry a better place. So thank you guys for being so wonderful in making that happen. Thank you, audience, of course, for all of your contributions. I'm going to hold this window open for a few more seconds, just in case you have any suggestions or comments to make on today's webinar, what we should do next time. The QR code is back on the screen, or at least it will be in a second, to make sure that you can access the first webinar and future webinars. And in the meantime, of course, we say a huge thank you to you and wish you the best of very good luck for the future. Do please get in touch with anything else that you need and for the follow-up to make sure this happens. Thank you, guys. Have a great rest of your week. Bye.